Commissioner, can you hear us? Come off mute.
Yes,
Good
I can.
afternoon.
All right, everything's working. So, all right, we're ready to rock and roll.
Oh, they got it fixed. Huh?
Yep.
Ooh, the nutrition.
You want to try it now?
Yeah.
Thank you, thank you, thank you.
That says that we are sharing our screen.
Gotcha. Yeah. I just want to see if it
You know, they've been advertising these cards for senior citizens to get grocery. Have you seen
Should be good to go.
right there, y'all.
And then.
Get rid of that.
Yeah. Slide out.
it? Who pays for the
Check.
electricity downstairs?
I'm gonna be here all day.
Who pays for the electricity
All right.
downstairs?
I'm gonna be sitting in the corner.
For the car?
I'm sorry about this. Yes, ma'am.
I guess the whole building's the city, so there might be some arrangement, but the county. Are we good?
We're good.
All righty. Good afternoon. Welcome to the November 21st, 2023 meeting of the Public Health and Human Services Committee of the Board of Mecklenburg County Commission. Start off with introductions. My name's Arthur Griffin. I chair the committee. The committee is made up of 4 commissioners, and today we also have a guest. So I'll start with the commissioners who are on the committee first that are here to introduce themselves.
Good afternoon. My name is Vilma Julie, and I represent the most powerful district in the county, and that's District 2. And to our staff and presenters, thank you for being here today, because it's Thanksgiving time.
All right, Commissioner Lee. Commissioners who are online, can you introduce yourselves, starting with District 1 Commissioner?
Good afternoon. This is Commissioner Elaine Powell. I represent the northernmost district in Mecklenburg County, Huntersville, Davidson, Cornelius, and North Charlotte. Thank you.
Good afternoon. I'm Laura Meyer and I represent District 5.
Thank both of you for being with us virtually. I'll now turn to our senior staff for introductions, starting with Mr. Trotman.
Good afternoon, Anthony Troutman, Deputy County Manager.
Good afternoon, Stacy Lowry. I'm Department Director of Community Support Services.
Good afternoon, Kim Henderson, Director, Child, Family, and Adult Services.
Good afternoon, Taya Cruz, Assistant to Deputy County Manager.
Afternoon, Robert Nesbitt, Chief of Staff for our Health and Human Services Agency.
Good afternoon, Yolanda Griffin, Director for Department of Community Resources.
Good afternoon, Lynn Martin, Adult Medicaid Manager.
Good afternoon, Kimberly Conyer, Family and Children's Medicaid Manager.
Good afternoon, Adonica Hampton, Economic Services Division Director.
Good afternoon, Sandra Durham, Interim Deputy Division Director in Economic Services Division.
Good afternoon, Mariah Long, Social Services Manager over FNS Food and Nutrition Services.
Good afternoon, Marquette Kilpatrick, Energy Manager.
Good afternoon, I'm Sabrina Crenshaw, Economic Services Division Manager.
Roderick Knight, Deputy Division Director for Economic Services.
Good afternoon, Scott Fritz, Social Services Program Manager over our Work First program and ESD Manager at our new EBS location.
Good afternoon, Melanie Armstrong, Social Service Supervisor with Adult Medicaid.
Hi, I'm Abby Wyatt, Livable Met Coordinator with Health and Human Services. Abby Wyatt, I'm the Livable Met Coordinator with Health and Human Services. Thank you.
Thank you all. We have a colleague that's a guest and certainly would like for her to introduce herself.
Thank you, Mr. Chairman. Susan Rodriguez McDowell, elected by the people of District 6.
And thank you and welcome to all of our guests who are attending the meeting virtually. This afternoon, we're going to have two reports, one follow-up from Food and Nutrition Services update. It's only about 10 slides, and then we'll go into our Medicaid presentation, which is twice the number of slides. So what I would ask my colleagues, please take notes, and once they've both completed their presentation, we'll come back to work through whatever questions we have. If that's okay with the folk online as well as the folk here.
How many numbers we have online, Mr. Chairman?
We have two members online, both
Excellent.
Commissioner Powell and Commissioner Meyer. The chair got it under control, Commissioner Leak. All right. All right. Mr. Trotman, I'll let you introduce the first presentation, sir.
Sir, before we go into that, it's not on the agenda, but you have the minutes to approve. Well, it is on the agenda.
I can't hear you, Mr. Trotman.
Yep, I missed that. Minutes from our last meeting. They went out to you virtually to all the members of the committee. Is there a motion that we approve
So
the
moved,
minutes
Mr.
of the
Chairman.
last meeting? We have a motion. Is there a second?
Second,
All right.
Commissioner Powell.
Commissioner Powell is seconded. Any discussion? Hearing none. All those in favor say aye.
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 Pose the same sign. All right, the minutes are approved unanimously. Thank you, Mr. Trotman, for catching that for me.
Sir, the first presentation is a follow-up to our last HHS committee meeting on the Food and Nutrition Services program. There were questions from Commissioner Meyer, Commissioner Rodriguez McDowell on our new applications. The focus of the last presentation was on recertifications, where we were getting the most complaints. But there were some follow-up. There were follow-up that was requested at that meeting, and Adonica Hampton is going to provide an update for you.
Excuse
All right.
me. Update on what?
The Food and Nutrition Services Program, the focus of the last presentation was on the recertification process. And there was questions on new applications. Where were we? Where are we? Are there any issues or problems? And what is our plan to resolve those issues? And Adonica is going to address that today.
And the number of people we serve?
Yes, ma'am.
Thank you.
And take good notes because after this presentation, we're going to go read into the Medicaid presentation.
Good afternoon, Chair Griffin, Health and Human Services Committee, Board of County Commissioners, colleagues, and members of the public. My name is Adonica Hampton, and I serve as the Economic Services Division Director. I was before you last month, and at your request, I'm here today to provide an update on our food nutrition services, specifically normal applications, because we focused on recertifications last month. I'll provide you updates on all three areas: expedites or emergency applications, normal applications, and recertifications. You'll see them all together today. The North Carolina Food Nutrition Services, or FNS, acronym for short, helps low-income households with monthly food expenses to end hunger, improve nutrition, and health. We have 162 eligibility staff trained to deliver food and nutrition services. 65 of the 162 provide services for programs in addition to food nutrition services. And 97 are aligned primarily to the food nutrition services program. All of our employees have varying levels of experience, from in training to very seasoned. We are thankful for the additional staff for food nutrition services that you approved in this current budget year to help us manage the high workload demands that we are experiencing. Last month, I provided you an update regarding food nutrition hiring, and today's hiring update is 28 new food nutrition services staff are starting to process some cases this week. 23 new food nutrition services staff are beginning training this week. Training and mentoring takes about 4 months, and the new staff will demonstrate some proficiency right out of training, but it takes about 9 months for them to be fully proficient. Also, as a recap, all households applying for food nutrition services are evaluated for expedited or emergency services. If the household's gross income is less than $150 or they have less than $100 in liquid resources, that's cash on hand, checking, savings, or if the household's shelter cost is more than the total income and liquid resources, then the household is eligible to have their approval expedited and benefits issued within 7 days. If the household is not eligible for expedited or emergency services, they are considered normal applications and must be processed, completed, and benefits provided within 30 days. Our expedited emergency applications continue to be our focus because we know these customers are our most vulnerable residents. As this slide indicates, after a decline in our timeliness as the public health emergency pandemic waivers ended in July, we have again achieved our target timeliness of 95%, in fact, exceeding it, in service delivery for emergency or expedited cases. We are now in compliance with the state performance measures in this area. Normal applications and recertifications data is being provided to you in one slide today because I wanted to highlight the correlations of our strategies to reduce backlogs in both normal applications and recertifications, as our new staff are hired, trained, and contributing to our service delivery. Normal applications, which is the blue line on the graph, increased application volume, ending of the public health emergency pandemic waivers, the ability to waive some program requirements at applications, created a backlog in our food nutrition services program for both normal and recertifications. As you can see from the left side of the graph in July, when those public health emergency or pandemic waivers ended. Over several months, we focused on stabilizing our emergency applications, which I just spoke about on the last slide. Over several months, we focused on continuing benefits of our customers needing recertifications. Keeping in mind, recertification households are individuals and families that were determined eligible recently. They are currently receiving benefits. When we shift staff, there's a direct correlation. We move staff from processing more recertifications, that red line, then recertification backlogs go down and normal application backlogs go up. Decisions about shifting the staff that we have because of the increased work volume is not easy, and we consider many factors. For example, based on processing data, almost half, 49% of normal applications being processed, the individuals and families are not eligible. All who apply are not eligible, while households needing recertifications were determined eligible recently because they're receiving benefits now. Our ongoing strategy will create continuous decline in our backlogs for both recertifications and normal applications. And in a little over a month since we last met, we have been able to reduce our normal application backlog by over 1,700 cases. Recertifications, the red line on the graph, as we reported last month in October, we have reduced our recertification backlogs for those individuals, those families, for their benefits to continue. We are continuing the process recertifications by the customer's benefit release date so that the recertification customers are not experiencing a delay in their benefits. We continue to utilize the staff that we have to be aligned effectively to the work presented. Our goal being a steady downward trend as our new staff begin to process. And we will reduce the backlog across the board, expedites, normal applications, and recertification. And that downward trend has begun in both our normal applications and recertifications, as you can see from the right side of this slide. I'll provide information about our strategies in a moment, but before that, the good news is our employees are processing 80% more than we were processing in August. From August to now, we have received over 25,000 new applications, historic high numbers. Last month, we began to process more applications than the number of applications being received. That's the only way to reduce our backlog, is to process more in a month than the applications we receive in a month. And in October, we did that, processed 9,000 when almost 8,000 applications were received, processed more than what we received in the month. The first week in November, our staff processed 58% more. November's not over, so I don't have data for that because every day is a different situation. Our employees are pushing it. They're doing their best to meet the demands of the rising workloads. The new staff starting to process this week will certainly help. Our current processing strategies, some of which I talked about last month, are using temporary staff, contracted staff to the most effective way we can, that they're able to provide services, providing overtime to staff to process more cases, realignment of staff as needed, which I've depicted in the slides with regard to research and normal applications, specialized processing teams and supervisors processing cases, processing more cases, more applications at first touch when we have all the information that we need to do so. And recently, we have reduced our food nutrition services staff in our lobbies doing intake, and we have realigned those combination staff to process more food nutrition services cases. These daily decisions and strategies involving the realignment of staff are tough decisions, and our managers and supervisors, whom many are here today, are working together across all programs where we have staff trained in multiple programs to determine how best to utilize the staff that we have. I'm confident that the strategies we are continuing to use and new strategies that we will develop, along with our new staff approved by you, thank you, will continue to make the necessary impacts to reduce, and our goal is to eliminate backlogs in our program so that all customers receive the benefits that they are eligible for, not only timely, but accurately. Thank you for your time and attention. Chair Griffin, you talked about questions, so I will turn it over if there are no questions at this time.
They'll have some questions for you after the Medicaid presentation, but thank you so much.
Yes, sir. Lynn Martin and Kim Conyer are our Medicaid program managers who will now come for Medicaid presentation. I just used the clip.
Thank you, Adonica. So good afternoon, commissioners, committee members, and guests. I'm Lynn Martin. I'm the Adult Medicaid Manager, and Kimberly Conyer is with me, Family and Children's Medicaid Manager. As we go through the slides, Kim is going to share some information with you. Now, I will say it might be dark and rainy outside, but we have some sunshine to bring to you today about Medicaid. Now, you may remember a few months ago, we were here and we talked a big umbrella view about Medicaid. We didn't get into all the details, and we're not getting into all the details today. We're going to give you an idea, but we're going to start off today. Oh, hold up. Hold on just a second. Left click the mouse. What I am? But it's not.
Try now.
No.
Try now. Okay.
All right, so we had a little snafu, but let me just tell you, Medicaid, we're going to start off with a really brief overview of what we talked about before. Then we're going to get into what's really exciting, 12.1, our Medicaid expansion. We're going to talk about our workload and strategies, our staffing capacity and training, our state partnership, because that is just critical for our success. And we've had some advancement in that area. We want to highlight that. Ways to apply. Now, a spoiler alert, it's the same way you've been able to apply, but we'll go over that. And then questions and answers. All right, so I want to start off though by talking about the difference between Medicare and Medicaid, because I'm sure all of you in this room get that question a lot. It comes up here a lot. So I just want to touch on that before we go into Medicaid further. Now with Medicare, I like to think of this as the federal show. They control this information, right? And if you live in one state or the other state, it's the same. It's 65 and older or disabled, certain conditions. Now, we'll note if you're disabled with Social Security Railroad, you got to wait 24 months before you get Medicare. But if you're end-stage renal disease, you don't have that wait, right? But for Medicaid, this is a state and federal partnership. And so there's federal guidelines that all states must do, but the states have some options. So if you live in one state versus the other state, you may notice that your benefits are a little different. Your eligibility is a little bit different. And there's an income and resource test. So those are the two main differences between Medicare and Medicaid. Both are helping you with healthcare, but there are some key differences with those two. All right, so prior to 12.1, we talked about who may receive Medicaid. So this is age 65 or older, blind or disabled, infants and children under the age of 21, pregnant, low-income individuals and families in need of long-term care, so you're in the nursing home, receiving Medicare. All right, basic eligibility requirements, be a U.S. citizen or show proof of eligible immigration status. Notice there's a little asterisk about that. So if you're an unqualified alien, you can still get emergency services. Potentially. You live in North Carolina, show proof of residency, have a Social Security number or show they have applied for one. Programs are for low income beneficiaries. Eligibility is based in part on what income and resources. Now for adult Medicaid. Individuals who are aged, disabled, and blind with medical care. Now this care can range from assistance with those Medicare premiums through full coverage for those in the nursing home. Potentially eligible customers are those who are disabled or blind at any age or those over 65. Now, a lot of people may think, oh, I broke my leg, I'm disabled. No, that's not going to meet our definition of disability. It's a physical or mental impairment which prevents an individual from engaging in any substantial gainful activity and which has lasted or is expected to last for at least 12 months or is expected to result in death. So if that is something that they believe they're disabled, then we have a little application that you complete, right? The packet is sent to DDS, it's a state agency. They have 70 days to make that determination. We'll process that case in 90 days. Adult Medicaid programs, we have lots of them. Medicaid for the disabled, healthcare for workers with disabilities, Medicaid for the aged, Medicare for the blind, Medicare qualified beneficiaries. So this is that partial coverage is known as Medicare aid. Dually eligible, so you're getting full Medicaid and we're helping with those Medicare premiums, deductibles, and coinsurance. Long-term care, so you're in the nursing home, we're helping with that care. Special assistance to the disabled, full coverage to clients in rest homes or adult care homes. special assistance in-home, full coverage to clients at risk of entering a residential facility, living at home. Now, a lot of you probably hear a lot about countable resources. This comes up quite a bit with adult Medicaid. And the reason being is because these things, people think, oh, I got to get rid of everything in order to qualify for adult Medicaid. Well, not quite, but we do look into a lot of detailed information. So bank accounts, boats, boat trailers, boat motors, not income producing, cash on hand, campers not used as a home site, personal property, so your vehicles, mobile and motor homes, investments, stocking, savings bonds, stocks and mutual funds. We're going to look into all that, and that is nowhere near an inclusive list, but those are the big things that tend to come up when we're starting to look in people's resources. All right, the resource limit. So there's a big range. It might be. It could be $2,000 for a family size of 1 and aged, or it could be $148,620 for an individual in a nursing home with a spouse at home. Now, in your packet, you have a little eligibility chart. So you can go through there and look at the income and the resources limits and a little bit about what the program is, so you have an idea about it. But we always say, if you think you have a need for healthcare, please apply. We'll determine whether you qualify, you don't qualify. If you have a need, please come in and do apply. All right, Family and Children's Medicaid assists low-income individuals, children and parents with medical coverage, children through age 20 who live alone with one or both parents or with other adults. Parents caring for children under age 19, pregnant women with or without other children. Now, Medicaid expansion. You may start hearing MXP. That's just a little abbreviation. You know, we love abbreviations at DSS. Medicaid expansion effective 12/1. Within the first year, it's anticipated that Mecklenburg County will see an additional 52,000 recipients eligible for Medicaid expansion. Over 33,000 have already transitioned from limited coverage to full Medicaid in Mecklenburg effective 12/1. So those people that were getting like family planning before, so some assistance with birth control and that kind of thing, the state has gone in and Fed 12/1, we have over 33,000 that'll get Medicaid expansion. We anticipate nearly 67,000 Medicaid expansion customers after full implementation within Mecklenburg County. So that's within a fairly short period of time. Residents who may benefit from the expansion. So who mainly are we talking about? More than half of the uninsured are under 40. Most are employed with high uninsured rates in hospitality, retail, and manufacturing. 1 in 3 uninsured are parents of children under 18. 52% of the low-income uninsured individuals are women. Now you have a flyer in your handout. It's a great flyer. The state put it out, and it talks about the main criteria for Medicaid expansion. So you got to live in North Carolina, be the age of 19 to 64, be a US citizen, and then the income chart is still low income. Notice though, for like a family of 3, 34,307 or less a year. Now I do want to point out what a game changer this can be for many in our community. If you think about individuals that have had, for example, mental health concerns and did not have any coverage, this can enable them to get that preventive care, to go to the doctor, to get the medications, to build that relationship. We all know oftentimes it takes a while to get the medications correct. So in Mecklenburg County, I know we have struggled a bit with people being born in poverty and staying in poverty. This is an unprecedented change that has the capacity to really enable people to fully engage in our community and move to the next step. So we are thrilled about this Medicaid expansion. When I talk about full Medicaid, what do I mean? So I'm talking about primary care and hospital services, maternity, postpartum care, vision, hearing, prescription drugs, behavioral health, wellness services, there's therapies and devices. This is life-changing. We talk about people that provide Medicaid and provide healthcare services, being life changers, life sustainers. This is life-changing help for individuals. And it's coming our way, 12/1. Now, Kim is going to talk about the year-over-year comparison of Medicaid.
Thank you, Lynn.
Good afternoon. As you can see, this is a comparison from fiscal year 21 to fiscal year 24, what our projection is. And you can see that for applications in Medicaid, we have remained fairly steady in our applications, but where our growth has been is in our renewals or recertifications. We've seen a 23% growth in the renewals and a 28% growth in our participants. And a large part of this is during the public health emergency. We were not terminating any customers that became ineligible. So we saw growth on our recertification side. Also at the bottom, you'll see the value of Medicaid benefits for the last 2 fiscal years. For fiscal year 22, we were under $1 billion, and in fiscal year 23, we were able to break that $1 billion mark. Now, for our backlog, when we were here last time, we did state that our priority remains in applications, and that is because applications are the customers without benefits. Our recertifications will be automatically extended if we don't get to those timely by the state, so there is no loss in coverage to our customers. And I'll talk more about that later in the presentation. On the top line, those are our overdue applications. We do have under 900. As of yesterday, we had a total of 794 overdue applications in Medicaid, and every day we work steadily to reduce that number to ensure customers are getting their benefits. The line below, the orange line, is our line of overdue recertifications. But one thing about our recertifications we need to note is that those are not really overdue. The state is automatically extending any recertifications we don't get to, but there is a technical issue on the NC Fast state system that we utilize. And so the customer's benefits are showing under their benefit history, and they're able to still access their benefits, but their certification period is not updated at the same time. So it shows as overdue on our reports. We are working with the state to get them to update the certification period at the same time as the benefit history. So their county on our side does not have to take additional steps to get that report to show accurately. For our Medicaid timeliness, the expectation is 90%, and you'll see in the month of July that we met it for Medicaid, adult Medicaid, and for family and children's Medicaid. That is due to approval of a performance waiver that the state issued. We do have a performance waiver submitted for August, September, and October due to the staffing challenges that we have faced, and we do anticipate that to be approved. So these are some strategies that we are putting in place or have put in place to deal with our overall workload. And some of these will be similar to what you saw during the Food and Nutrition Services presentation. We are utilizing county temporary employees and contracted temporary staffing to staff our call center. This enables us to remove our eligibility specialists from the call center so that they can be processing work. We're also utilizing eligibility staff from other counties via a contract agency to help process applications. We have formed some specialized processing teams. One example is we have deductible cases, which is one of our more complicated areas in Medicaid. Customers have to submit bills, and we have to verify that they have enough to meet. So we've utilized that to help streamline that process and ensure that the benefits are being issued correctly. We're also utilizing overtime for our employees, and thanks to the commissioners, we also have the 67 Medicaid positions that were approved for the expansion. And the big news is, as of last week, we have some of them starting to process in Medicaid, which it'll be slow because they're learning, but every little bit helps because as we've talked about, training is extensive. For Medicaid training, it's due to the complexity of the program. Training includes policy training, our systems training, practical where they're actually starting to work on the cases, and then mentoring where they're working cases and then getting them checked. It takes roughly 5 to 6 months to complete this training. And then after that is finished, it takes over 9 months for a family and children's Medicaid worker to be considered experienced and over 12 months for an adult Medicaid worker to be considered experienced. For our staffing in Medicaid, Family and Children's Medicaid has 128 staff that are trained in Family and Children's Medicaid. Out of those 128, 114 have more than 9 months of experience, so we would consider them fully experienced, and 14 have less than 9 months. For adult Medicaid, they have 24 staff that are fully trained in adult Medicaid. 21 of them are what we would consider fully experienced, so more than 12 months of experience, and then 3 that are under the 9 months. So the 128 looks like a great number for Family and Children's Medicaid, and it's good, but all 128 are not focusing on just Family and Children's Medicaid. Out of that 128, 71 are working in Family and Children's Medicaid only. The other 57, no Family and Children's Medicaid, but are working in our other eligibility programs as well, whether it be food nutrition services or our Work First Family Assistance Program. Now, who we have in training. Thank you all. Again, a lot of this is the impact that you've made. We have 108 Family and Children's Medicaid workers in training, 108. And then we have 28 adult Medicaid trainees in. So that will make a huge impact as they become proficient and get on board. So again, we can't thank you enough. Now let's talk about waivers within Medicaid. We are working with the state where we are currently able to accept self-attestation for many verifications in Medicaid, which has been extremely helpful. And we support the state in requesting a further extension of this waiver. Currently, this waiver is set to expire May 31st, 2024. And then hot off the presses, we were notified last week that there's an additional waiver that the state has approved, where the state will automatically provide an additional 12 months of benefits for the following recipients. Children under the age of 19, so 18 and below, they will get an additional 12 months of benefits, and that is effective with our certification periods ending December 31st. Parents and caretakers will get an additional 12 months automatically by the state, and that's going to start January 31st, 2024. And then also adult Medicaid cases with income below the 100% poverty income level and who do not have resources, as Lynn spoke about, we do look at resources for that program that indicate a reserve issue. So they would also get an additional 12 months of benefits. But what does that mean? Good question. In Family and Children's Medicaid, children's cases and parent and caretaker cases account for approximately 65% of our workload in recertifications based on our data from December, January, and February. This waiver will have a huge impact on our workload as we will not have to evaluate that 65% starting in December for the children, and then the 65% January and December. Also, as the state noted when meeting with us, and Mecklenburg County wholeheartedly agrees, this will give us time to get our staff trained and proficient. So they are ready to go when we resume the processing of all recertifications. Currently, this waiver is set to expire with the ending of our continuous coverage unwinding, along with the other waiver on May 31st, 2024. But according to the state, there is a good chance that these waivers will be extended. So fingers crossed, we fully support that as well. In addition to the waivers that the state has issued, we also have straight through processing where the state system automatically reviews customers who are actively receiving food and nutrition services to determine if they qualify for immediate approval of their Family and Children's Medicaid cases. This is not a process we're able to use in adult Medicaid yet. So we support the state requesting a straight through processing for the traditional applications and recertifications. And when we say traditional, we're discussing adult Medicaid applications and recertifications. And in addition, earlier in the presentation, I mentioned we prioritize applications because those are the customers without benefits. And that is because the state will do monthly extensions for any recertifications we do not process timely. They'll give them 1 to 3 months automatically to ensure that they do not see a lapse in their benefits. And last but not least, we have the permanent telephonic signature, which has been a huge help on the customer side and the customer side and on the county side, because by being able to take the customer's signature over the phone, that eliminates the need to mail paperwork to them, wait for it to come back. It speeds up the process so we do not have to hold anything for those signatures on the applications or our renewal forms.
I want to interject real quick. As you see, these waivers are for Medicaid. We don't have the same waivers for food nutrition services. And so there's no permanent telephonic signature. There's all of these things is just very different. And so when we evaluate families for both programs, we're following 2 separate sets of rules, which makes it difficult for our staff.
But these are state waivers though.
Well, they have to be
from the feds.
Yes, right.
Okay.
That's correct.
Got it.
Mm-hmm. Oh, okay. And we've talked about all of our different programs and all the great benefits we have for the customers, particularly with Medicaid expansion coming. So, and as Lynn said, it hasn't changed, but let's review it again, the ways that a customer can apply. They can apply in person or pick up a paper application at any of our 3 locations, Wallace H. Kuralt, Valerie C. Woodard Community Resource Center, and our newest location, Ella B. Scarborough Community Resource Center. They can apply over the phone, or they can apply online at our epass.nc.gov or at allaccess.mecnc.gov. And we included with your packets today an example of what a paper application looks like for the customer. And you can see it's several pages. It's a packet. There are 32 questions that the initial household member applicant has to fill out. Then each additional household member that they need to add to the application, there's an additional 30 to 34 questions for each additional. Then after you get through the household members, there's 13 additional pages going into further detail about any of their information, income, resources, that sort of thing. So you can see it's a very extensive process that the customer has to go through. And then once we receive it, the information we need to review to determine the eligibility. Thank you. That concludes our presentation for today.
Thank both of you for an excellent presentation. What I'd ask my colleagues, if we could sort of unpack this one at a time as opposed to both. So Medicaid was last. Let's just start with Medicaid. And so I'll start with Commissioner Leek. We'll try to do a 3-minute rounds and then we'll come back.
Thank you.
Okay.
Let me say thank you to the staff for your time and work that you put in to make this possible for our community and for the largest county in the state of North Carolina. And we're still looking for people to work, am I right? So that means a lot to this community. So I just needed to say thank you, as I always do. When you talk about food and nutrition, and I look at my district, which is District 2, the hub of anything that's wrong, people want to say you can find it in District 2. And I always try to say to my people that things are getting better, procedures getting better. as it relates to filling out forms. Do we have staff to help those who cannot orchestrate to fill out these forms? And the reason I'm asking, I know of a case just a couple of weeks ago of a young woman who I knew as a student in high school and was a member of our church years ago, who's now an invalid and lives alone, did live alone, but they had to find some place for her to live. Who would come in and support information for this a person who's in that condition? Because this is powerful and you find it in our community.
So she can always call and we can take the
Speak into
application.
the microphone.
So she can call and we take the application over the phone. So there's no need for her to come down, no need for her to read through that information. You can call and we can take the application right over the phone. If you want to come in, then if you come in, then the worker will sit with the individual and take all that information that is needed. If for some reason they could not come in, they could not call in, if you contact us through the call center and we need to have somebody make additional attempts out there, like social workers and things like that, to get the information, then we'll do that.
Commissioner Leek, if you can turn on your mic so your
Oh,
colleagues can hear you.
Maybe.
Yes, ma'am.
Thank you. This helps. Now, the last questions, I won't take too much time right now. How do we disseminate this in the community? I always pick up extra copies of handouts that we have. And these will go into given communities in my district that I deliver so that they can have the information available on sites such as the rec center, as well as House of Faith, so that they're there. But many of our ministers may not have the know-how or the answer to many of the questions that people would have. So I'm getting ready to have a town hall meeting in District 2 to talk specifically about these urgencies that's needed in the community, if that's possible. I'll work with you, Mr. Jordan. And my last comment will come later. But thank you, and again, thank you, staff. Thank you. You just don't know. I had a young woman who had 9 children. And I got upset with the number of children and moving to Charlotte.
Excuse.
Many people come to Charlotte for services that we have. They ride buses to Charlotte. They come from other countries to Charlotte. So how do we address those issues? And that's a fact. It's not something I'm making up. It's a fact. How do we address those needs?
Can anybody respond to how do we respond in terms of our marketing, outreach, et cetera, is what Commissioner.
So
Leek
I
is
will
referring
say that our outreach, like we'll present a crisis assistant ministry. When individuals reach out to us, then we will go out and share information. The state has done a webinar for partners as well about expansion. We've sent flyers about the expansion to, Salvation Army, Goodwill, Community Support Services, Health Department, the criminal justice system. We've met with them and sent information to them, Alliance, and more. So we've been sharing information to try to make sure that people know about the great benefits that are out there, because the more they know, the better we're able to process applications faster and faster. So we want to make sure people have the information that they know that's regarding how to apply and what is needed likely when you do apply.
So, and I just want to address that. This is an issue for us, marketing, communication across all the various programs, which is why we have, new marketing manager and public information. But this is an opportunity for us to arm all of our community partners, grassroots organizations with information so that customers, when they come and present themselves, they'll be prepared for the interview and they'll have all the necessary documentation. We're also will be working with our community health workers to make sure that they have the necessary information. They're out in the community. We want to make sure that they're prepared to also educate our community on how to engage us. Part of the issue is many people, when they present themselves, they're not prepared. And so sometimes there's 1, 2, and even 3 interactions with each customer. That's an issue because of our capacity. So we're going to be working on that over the next fiscal year.
And I also just want to bring your attention to some of the packets that we passed out. And one of them is a flyer about the Medicaid expansion that we've been sharing with the community partners so that they can see who's impacted and some of the requirements and what the income limits look like.
All right, let me go to Commissioner Powell.
I am here. So I have a couple questions. Thank you so much for the presentation and all the hard work. It's interesting to be remote because you can hear things that you don't normally hear. And so I can hear some of the feeling that people have been working really hard to resolve this, and you need to know that we are grateful for it. So thank you for all the hard work. My first question is kind of spun off of Commissioner Leek's comments. I would like to know why regionally, why people would come to Charlotte. Why aren't other counties doing the same thing? I'd like to have an understanding of why people are magnetized to coming to Charlotte. The second thing is, you were speaking about the 128 employees that we have, but that 57 of them have to go into other areas. And I'd like you to speak to that a little bit more. And then when you were talking about the number of questions for each family member being so extensive, I'd like to know your thoughts on that. Like, is that do you think it's too much, or is it just part of the burden of the application? And I can repeat them if you need them. But starting with what brings people to Mecklenburg to get benefits is my first.
Well, Commissioner, I want to address your first question and I'll address the other ones. I mean, one, this team can't answer that particular question. That's something that we need to talk to our strategy planning evaluation team when they do community surveys. But these programs are federal benefits. And so it doesn't really matter where they are, as long as they meet the eligibility criteria. We're obligated to process the cases. But as far as what is going on with migration, that's something that I need to talk to Dr. Allen about to provide an answer.
I appreciate that, because I wondered, it seems that all neighboring counties, even in the state of North Carolina, would have to provide these benefits. And so I just wondered. But on to the 57 of the 128.
So the 57 of the 128, they are trained in multiple programs, whether it be food nutrition services or the Work First Family Assistance. We have staff that are cross-trained in multiple programs. So when they come down into the lobby, they don't necessarily need to see more than one worker to get the benefits that they need. Those workers that are cross-trained in those programs are able to service them in a better capacity because they can see that one person. I can't remember the third question.
It's the extensive questionnaire. You said there were so many questions for each family member, and I wondered if you thought that it was too many.
It's a state mandated application to gather all of the necessary information to determine their eligibility. If there's some way we could see to streamline it, of course, that would be ideal, but when someone's applying for the government benefits, there is a lot of information that we need. And if you're not sitting down across from a worker who's gathering that information, entering it into the system, and you're submitting it on a paper application, we need to gather as much as possible. In case, as you know, we have some customers that have a more fluid living situation, so they may be harder to get a hold of. So the more information we have, the more we're able to ensure we could process that application.
Commissioner Powell, it's a state forum, it's not our forum, and we can't modify the forum.
I understand that, but you know, like when we have dialogue with state leadership, it always helps to have input from the experts. And so I appreciate that. Thank you.
And they are the experts, so yes.
Yes, I appreciate that. And I'm thankful for them.
All right.
Thank you.
Thank you. Go to Commissioner Meyer.
Thank you so much, Mr. Chair. Thank you to the staff for this presentation. I know it's a lot of work to get these presentations for us, and we so much appreciate it. Also the work you're doing. I know what Commissioner Powell said, when you're online, you hear different things, and I do hear your passion and your concern and how caring you are and excited for the people who are going to be receiving these benefits. So thank you for your dedication. Really, only one question. Commissioner Powell took two of mine. This may not be the right team to ask, but if single payer healthcare happens, or Medicare for all, would this affect the expansion of Medicaid? Would it even exist? Or would the whole thing just change and you would have to revamp everything?
Yes, you're right. It's not the team.
Good question. Good question. Okay.
The pay grade.
The entire system of healthcare would change, both Medicare and Medicaid, yes.
So Medicaid would not, it would be just combined the same thing, right?
Yes, everything would change.
Okay. That is all. Thank you.
All right. Let me see if guest commissioner here has a question for you. Hold on just a second. Let me tee this thing back up here, you know.
Oh.
All right, go ahead.
All right. Thank you, Mr. Chairman. I just have one question. I mean, I echo my colleagues, and I really thank you for bringing the sunshine today, because we sure did need it, and you really did. So thank you for that. But I was just wondering, on page 16 of your presentation, where it talks about the value of Medicaid benefits, I just wanted to make sure I understand or really figure out, do you mean the value to the customers, like how much they get in like relief, or is that the value like to the county, like as for passing through, you know, paying for our employees and things like that, the staff that it takes to run this whole machine? Like, what does it mean by the value of the benefits?
Our numbers expert.
Yes, Sandra Durham is coming up to answer the question about the value.
Thank you. So that actually is a direct correlation to the claims that were submitted. So those are the dollars coming into our community that are supporting the customers at whatever healthcare facility they enter.
Okay, so that means it's not for our staff, and
No.
it would be a higher number if we included, because.
Right, this is not the cost to administer
Okay.
the program locally.
Okay.
These are the dollars that are coming to our county to serve the customers that are receiving healthcare.
Okay, thank you so much.
Solely.
That really helps.
You're welcome, thank
All
you.
right, that was it for me.
Susan, I'm gonna take a part of your time. I asked Adrian last year, maybe this year, I've only been on here 11 months, okay, this year, to give us feedback on the economic impact. You always hear about, we want to bring in the tennis group, we want to bring in the corporation. 4 programs, this is one of the 4 programs. This was the beginning of the year. Those 4 programs had a $1.5 billion impact. And based on what they've just shared with us, if Adrian gives us that information again, it'll have probably $2 billion worth of economic impact that those 4 programs have on the economy here in Mecklenburg County. So when people talk about economic impact, poor people, the money doesn't go into their pockets, it doesn't come in our pockets, but it goes into the economy here locally.
Right, thank you.
I had just one short question in terms of turnover. And I guess that would go across the board, but can somebody speak to your turnover? I like the fact that you tiered your staff, or at least it sounds like you've tiered your staff like senior eligibility specialists that can really go through stuff, and you got beginning folks that sounds like that's workable. So got my own self there, but just talk to me a little bit about the impact of turnover and the impact of, I guess, the senior specialist, the senior eligibility specialist, because it sounds like you have people who can go wherever they want to go in the Economic Services Division.
So we call those combination workers, and you've heard both of us on the food nutrition services side as well as Medicaid presentation, but it applies to other programs. We are extremely fortunate to have staff, employees who are able to learn multiple complex programs. In my experience, I haven't seen to the level that we have here. Now, of course, I haven't been to all 100 counties, but I'm impressed by that. Now, everyone can't do that. It really does take a certain skill set, and we have many. So that helps us to deliver our services across the board so that we can move individuals to process in one area when there's a greater need, and that's valuable. With regard to, so yes, we have staff of varying experience levels, mentoring programs, as you heard us talk about, that's a part of our training. And that's extremely helpful. Turnover, we don't have any turnover rates. I haven't captured that since I've been here, but we're always focused on it. We know people come, we know people leave, and we want to keep them all. But that's part of, even when we talk about combination workers, those employees that don't choose to learn multiple programs, that's okay too. You can be proficient and an expert in one program, and we love that as well.
So just to piggyback on that, we can get you the turnover rate information, but we are fortunate working with HR that if a person is proficient in 1 or 2 or 3 programs, they're able to go from an economic services worker 1, 2, or 3 without going through the whole interview process. So as much as they are able to learn, they don't have to interview, and they will get an increase based off of their capacity.
Yeah, I was sort of going in that direction as we have provided, the manager has provided additional incentives for medics, dispatchers, and for programs in the medic area. It has helped them with their hiring and retention. If we continue to have the challenges in economic services, that would be a good question for us maybe to put on the agenda for January in terms of, for the manager, are there budgetary implications for us to put in place a system so that those folk that are doing the cross-program eligibility stuff to be compensated.
Yeah, and that's what I'm referring to. That's what we did last year.
Okay.
In the past, they had to go through an interview process to go from a 1, 2, or 2, even though they were proficient. Now they don't have to go through that extensive process, and there's an increase, there's an incentive to do that. There's, we constantly look at equity. Yolanda and I talked about that today. And there's some equity requests that's coming to HR here soon for those staff. So it is something that's something that we are always concerned about.
Yeah, I think I can't speak for all the commissioners, but I think certainly the concern that's been expressed previously about trying to deal with timely processing and what it takes to get there. We're all supportive of you, whatever differentiation happens to be with regard to staff, to make sure that we are able to recruit, but also to retain appropriate staff in that area.
That change was a was a huge benefit to us to be able to elevate staff from the various levels within economic services. I don't know if Yolanda, you want to say something?
No, I was just gonna agree with what DCM Trotman shared. The other thing that we have the opportunity, and that's called our career ladder. So that's the change that DCM Trotman spoke about, is the career ladder opportunity where individuals can make that decision to move from one program to two programs. The other piece of that is that we need great trainers in our area. And a lot of times those staff that have that longevity, that have that experience, those are the ones that tend to be good for our training area as well. So there's that growth opportunity within the division to move to our quality and training area as well. However, of course, when you promote individuals, that creates then vacancies in your caseload. So that's one of the things that we continue to work with as well. We had a great opportunity. Our team focused on the positions that you were able to provide us. We did great work with partnering with HR and partnering with our other department staff who assisted us with doing what we called hiring blitzes, which Adonica spoke about last month. And so we had a great pool of candidates to be able to bring those individuals in to our eligibility specialist positions. So again, as the team focused on, we are seeing those, the opportunities with these new staff coming in. Part of that was for Medicaid expansion, as Kim talked about, but a lot of those positions really went to us being able to manage the current workload. So it wasn't just the Medicaid expansion, it's what has this current workload become. And so making sure, as you said, that we're able to retain those individuals, not just hire them, but retain them. And that's a big focus that we're looking at as well.
And Yolanda, you started off as a case manager yourself.
I did. I started out back then they called us intake specialists. So I was one of those people who knew multiple programs. So I was doing the food nutrition. I did the family and children's Medicaid, refugee assistance, and cash assistance. And as the team alluded to, the training takes so long because the policy is complex. That's part of the reason that the packet is that long, because there's so many policy implications that we have to evaluate for. And so the staff really have to be well-trained, not only with budgeting, but being able to manage that policy and understanding the policy. Adonica spoke as well about the NC FAST system with the team, which the team alluded to. So there is a lot to the job of determining eligibility in these programs, and the staff that we bring on really have to be able to have that skill set to maneuver those different areas.
Thank you. Let me go back to food stamps and see if there are any follow-up questions. I wrote myself several little notes to say at the very end, but let me see if there are questions for food stamps. I'll start off again. Commissioner Leek, if you want me to go to Commissioner Meyer or Powell, I'll do that. I started with you first last time.
I'll yield to them to let them be first. And
All right, Commissioner
Commissioner
Powell, if you're still with us, we're gonna.
Thank you, Chairman. I am still with you. Ms. Cruz is going to save the printed packet for me. And then I might have more questions from that. But I just want everyone to know we're really thankful for your work. I could feel it in people's voices, like how they're so grateful for increased staff, but there's still so many challenges. And I appreciate that you're working so hard to meet the challenges. And let us know what else you need if there is anything. Thank you.
Thank you, Commissioner Powell. Commissioner Meyer.
Thank you so much. I also want to echo that. I really do appreciate the update. And again, I know making these presentations can be probably a thorn in your side, but it really does help us to understand the situation and know what's going on. So thank you. Thank you for your hard work. And I'm excited about the new staff. I hope it's going to continue to work out And like Commissioner Powell said, please let us know what we can do on this end. We want to support you. Thank you.
All right, Commissioner Lake.
Thank you, Mr. Chairman. When I look at food stamps and nutrition services, I think back to the time of President Johnson, and we talked about poverty. And America, the most wealthiest country in the world. And yet we have people who are born into poverty and stay in poverty. So our efforts ought to be looking also along with getting people out of poverty so that they can be productive citizens and come take some of these added jobs as we move forward in our work. What is it we need to do to say to Mecklenburg County that we're working to rid ourselves of poverty? What are we saying, Mr. Chairman? Mr. Trotman?
What are we doing?
How do we work better to make it happen?
Well, I mean, definitely that's another presentation. The economic services is meant to stabilize, not so much to elevate an individual out of poverty. It gives a person an opportunity to be healthy, to have food nutrition services. But workforce development and economic development, that's a separate presentation.
But if we can remember when the kickoff was in the mountains years ago with President Johnson talking about eradicating Americans who live in poverty, who's born in poverty. And we hear this a lot about Mecklenburg County, who are the people who find themselves in that poverty level. And how do we, and what should we be doing that's different to help to remove them from that level of economic stability in this great community? Because we're still there, and it's still a problem across this country. I look at some of the pictures that come on TV of other countries. I've traveled to Africa 7 times and been to other areas, and there's nothing like poverty in other countries compared to America. We're still wealthy based upon the status. But when we look at poverty here and look at the zip codes and health conditions, and you have people who speak against age. I did not realize that we had people in America, in Mecklenburg County, who have problems with folks who live long. Never thought I would ever hear that.
And lastly, Commissioner Leek, the Chetty study, the Harvard study that said that we were 50 out of 50. There's a new report that's coming out that says we're in a much better position than the original report. And I believe that report is coming out in January.
And who's that coming from?
That's coming from Harvard.
Roz Chetty.
Roz Chetty.
He was just here last week.
Okay.
Yeah.
Thank you.
All right.
So that needs to be shared with the community.
Right. I'm sure it will be. They've already working on how they gonna present it. Commissioner Rodriguez McDowell, you get the last 3 minutes.
Thank you so much. So Adonica, on your presentation, I want to make sure I heard you correctly. Did you say that over half who apply are not eligible?
Based on recent data, we looked at those normal applications and 49% recent. Yes, the recent data that we looked at, 49% of the applications received were not approved, meaning not eligible. Now that could mean they didn't turn in all the paperwork so know that those denials doesn't necessarily mean eligible, because there's lots of reasons why an application is denied.
Okay.
But that's a very high number. But like I said last month, the work is the same for the worker to determine whether someone is either eligible or not.
So, because I don't really know how this works, does someone come in and sit down and fill out paperwork, you know, with our workers at these centers? And if the worker is like doing this intake and they are like, okay, this ain't gonna work, do they just go, hey, sorry, I know, or do they have to still go through the whole thing?
The entire process.
They
In
have
other
to go
words,
through.
those rules and the information on the application,
Okay.
we need to determine if they're eligible based on those federal and state rules.
Okay, so it has to be submitted to the state, even if they go, we know this isn't gonna.
The county determines the eligibility. We utilize state rules and policies.
Oh, we do.
But the
Oh,
county,
okay.
our staff determine if someone is eligible
Oh.
based on, that's what the training is about, so that they can determine that eligibility. And we screen for food nutrition for emergency or expedites. We don't screen about denying or if they're not approved.
Okay.
That makes,
Okay, gotcha. And on the packet, do we have folks that are sitting down, filling it out with you? Or do you have to keep coming back if you keep screwing up how you're filling out this big giant packet?
no, if we receive application in any program, whether it's in the mail or our drop boxes, and we have questions, we call the customer and try to handle those questions over the phone.
Okay, okay. So you don't come in for an appointment and sit down and open it up and go, okay, let's fill this out together.
No, but we have many customers that present themselves at our locations to apply.
Okay,
And we provide those services to apply in the best way that's right for them.
okay,
If those who need help, we help them. Those who can fill out the application, they can do so. Those that can apply online, do so as well.
okay. So you meet them where they are.
Yes, yes, ma'am.
Okay, thank you so much. I really appreciate y'all's work and appreciate so much your responsiveness in these presentations. And I know it's a chore, but it really does help a lot. So thank you.
Friday, right on time. So, get this thing started here. I'm just delighted that we've gone through the major portions of our economic development programs, our needs-based program, with the big ones, food stamps and Medicaid. And one of the numbers that was presented both during our last presentation and this presentation, but more particular, I wanted to just recall the projected forecast for FY '24 is 367,080. 367,080 residents of Mecklenburg County are projected to come through
It's still growing.
our folk. So, I mean, you guys are doing a heck of a great job in terms of processing that. But as Dr. Leek said earlier, we have to figure out a way how to nibble away at some of these folks so we can reduce the rolls for poverty in Mecklenburg County. I think clearly we have the opportunity to do that. These programs are need-based. I didn't know until joining the county that states are different in terms of how they administer the programs. And it's my understanding, and you guys can correct me if I'm wrong, that North Carolina runs the program, but assigns it to the counties to administer. And in South Carolina, the counties will administer the program.
state.
The state.
Yes.
Okay. So it's a situation where we have to do what the rules and regulations dictate
right.
for us. And then we have to manage it as best we can for the residents here in Mecklenburg County. So I want to thank you all for bearing with us as we went through these two programs. And I hope the public that's viewing our committee meetings has learned as much as we have in terms of what the implications are, both for the residents of Mecklenburg County, but also for us who have to implement and discharge those responsibilities. So I'm pleased. I wish Mr. Trotman at some point I can talk to you. What's the other programs? Wick and TANF? Are they?
Yes.
Are they very small that we can do both of those at one time? Or are they
Yes.
huge?
No, we can do both of those at the next meeting.
I just think we have to go through and share with the public, just to educate the public in terms of what are the need-based programs here in Mecklenburg County that we provide services for our residents who find themselves in financial hard times and not able to afford food or medicine or housing, but more particularly in terms of the needs-based
Healthcare.
program that Department of Social Services is responsible for, WIC, as well as temporary assistance for needy families. I think those are important programs. So without further ado, we're 4 minutes before our time to dismiss, but I'll take a motion that we adjourn and we'll pick up on these other two programs
So moved, Mr.
next
Chairman.
time.
Second.
All right, been properly moved in second that we adjourn. All those in favor say aye.
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 Time to go.
About the newspaper.
Thank you so much. Thank you.
Information newspaper.
Yes, I'm gonna get, I know. So Monica does have the immigration information. What?